Hey guys, welcome back. So today we're going to talk about how to take a nursing report, L&D style. I'm going to show you how I set up my papers, my little cheat sheet or my brains, and we'll talk about all the pertinent information that you need to know during hand. So come on with me. Let's take a look at this sheet, okay? All right. Okay. So we start out with a blank sheet of paper. Normally I use a quarter size of this sheet, but for this video purpose, we're gonna go ahead and just use this large sheet of paper. So up in the corner here is normally the patient's label. Okay. And on this label, there's the name, the date of birth, age, medical record number, and the financial number. Also, date of admit. Okay. There's also a little barcode here to identify the patient. So then I'll label it. Let's say the patient is in LDR room 2. So what do we need to know about this patient? So let's say this patient name is last name is Beauty. First name is Sally. I like that because I like Sally's Beauty Supply. Don't judge me. Let's say she's 27 years old. All right. So she is a G2, meaning this is her second pregnancy. P1. She has 1 kid at home. Let's say 39 weeks and 3 days pregnant. Okay, so I like to then go into her lab work, because if anything goes wrong or awry or anything, I need to know her labs. So we'll start with prenatal labs. So we'll start with her blood type. Let's say Miss Beauty is O positive. We need to know her GBS type or her GBS status. Let's say Miss Beauty's GBS status is negative, which means she doesn't need any antibiotics. Her rubella is immune, meaning she does not need an MMR, and the rest of her prenatal labs are negative, meaning her gonorrhea, chlamydia, HIV, Hep B, all those types of prenatal labs that we take at the beginning of pregnancy and somewhere towards mid to late pregnancy. I also need to know her allergies. Let's just say let's say she has no known drug allergies. So we denote that no known drug allergies. Let's put an S on that. Okay, so you want to know why she was admitted. Did she come in because her water broke? Did she come in because she was just laboring? Is it preterm labor? Is it hypertension? We all need to know. So let's say Miss Beauty came in because her water broke, and we say that means she's SROM, spontaneous rupture of membranes. So I put that normally up here. So spontaneous rupture of membranes. Now, when someone breaks their water, we need to know when it broke. So let's say she broke her water on 9/23/16, and at what time? Could be 8 p.m. Now we need to know what color it was. Was it clear? Did it have a green tinge to it? Was it bloody? So we need to know that status. So let's just say it was clear and there was no odor to it. Next, we need to know her medical history. Does she have any medical history? Anything that we need to know about? So let's say Miss Beauty has hypothyroidism. And is she taking any medication for that? Okay. So let's just say that's her only history. Now we need to know, is Miss Beauty on any medications? Okay, so let's say she came in and she wasn't contracting very frequently, and we needed to start her on some Pitocin to help her labor and increase her contractions. So let's say she's on Pitocin. Well, actually, before we do that, how many centimeters dilated is she? So we denote a cervical exam. I normally put CE. So let's say she's 6 centimeters, 90% effaced, and she's -2 station. And we need to know what time she was last checked. So let's say she was checked at 11 p.m. So 2300. Or you can put 11 p.m. And her Pitocin. So we need to know what time it was started. So Pitocin was started at 23:30. Sorry about that. And now we need to know how much Pitocin she's on. We need to really keep track of that. So let's say she's on 4 milliunits of Pitocin. And the last time we increased it was at 1 a.m. Okay, so we need to know that. Now, is she doing natural labor? Does she have an epidural? Let's say Miss Beauty has an epidural. So we write epidural and what time it was placed. So let's say she got this epidural at about 2 a.m. Okay, so we need to know that. And with the epidural, you always get a Foley. So let's make sure we put Foley catheter. And I make a little box and say that it was done. Okay, so then you want to also report off on her fetal monitoring strip. So it tells us a lot about the baby. So, let's say if she was category 1, category 2, you want to report off on that. So let's say baby has been category 1 all day, and then her contraction pattern. So her contraction pattern is about every 2 to 3 minutes. Okay. So after you describe the baby on the monitor and the contraction pattern, you can also, you want to let the nurse know where the IV is. So let's say she has a left forearm 18 gauge, and let them know that it's flushing well. You also want to let them know who's at the bedside. Does she have any support with her? So you can say father of the baby, and let's just say his name is so Matt. Father of the baby is Matt, and he's at the bedside. Also, she has her mom at the bedside, and you can denote, let's say her name is, I don't know, Liz, and you can write down how they what they like to be called. And that's really about it. Unless she's getting some other medications, you may want to let the nurse know when those medications are due. Also, if she's close to delivery, and we denote, let's see, she's 6, 90, and -2. So I would say that it would be time to set the table. So what you would do is make a little note over here. You can put it, well, I normally leave this area right here for me to take a little note. So down at the bottom of the sheet, do you have your delivery table set? Is the baby warmer set? Do you have your delivery papers? And those are forms that we need. We just use them at our hospital. I'm not for sure if everyone uses them. Do you have baby bands? And when you do have these things, check them off just to say that they're done. Okay, so after we have all of this information, oh, actually we're missing one thing. If her water is broken, here at my hospital our policy here is to check mom's temperature every 2 hours. until her water has been broken for 24 hours. And then after 24 hours, we check it every hour. So you want to make sure we let the nurse know about the vitals. So let's say her vital signs are 36.8, which is normal. And then you also want to have frequent blood pressures because she is on an epidural. So let's just say her vital signs are 128/70 and heart rate of 80. Respirations are 18. Okay, you want to make sure you do respirations because of the epidural. Okay, so after you have all this information, what do you do with it? You report off to the next nurse. So you want to make sure it's thorough, it's clear, concise, and you have all the information that you need to pass along. So with this, how would I give report? So let's say the incoming nurse is Christine. So I would say, hey Christine, you're taking Mrs. Beauty in labor room 2? Okay, sure. So we'll go to the bedside and I'll give a little bit of report on her. I'll just let Miss Beauty know that this is your oncoming nurse. Her name is Christine. She's going to take great care of you. So I would start out by saying, Christine, this is Miss Beauty. First name is Sally. She likes to be addressed by Sally. She's 27 years old. She's a G2P1. Gestation is 39 and 3. She's O positive, GBS negative, rubella's immune, prenatal labs are negative. She has no known drug allergies, and she came in because she broke her water. Her water was broken on 9/23/16 at 8 p.m. Her water was clear then, and the fluid is still clear now. She has a history of hypothyroidism, and she's taking Synthroid for that. Last cervical exam was at 11 p.m., which was 690 and -2. We started her on Pitocin at 23:30. She's on 4 milliunits of Pitocin at the moment. The last time I increased it was at 1 a.m. She's had a regular contraction pattern and I didn't need to increase it. She got her epidural at 2 a.m. and it is working fine. She has no complaints of pain. 0 out of 10. She does have a Foley catheter in and it is draining clear yellow urine and there's no odor to it. We've been taking her vital signs frequently. Her last vital sign was 36.8 and that was about an hour ago, so she's due for another temperature in about an hour. Her other vital signs are within normal limits. She's 128/70, 80 is her heart rate, and 18 respirations per minute. On the monitor, her baby looks wonderful. It's category 1 and she's contracting about every 2 to 3 minutes. She has a left forearm 18 gauge that's flushing well and it's running the fluids well. She's also receiving LR at 25 milliliters per hour. As a support team, she has her husband here. This is Matt, and her mom. Her name is Liz. I do anticipate that her labor is moving along quite well. She has been checked since last night, so she's due for a cervical exam this morning after the doctors do their rounding. So I've set your table and I've set your warmer. The only thing that you need is to fill out the delivery papers and the bands. Do you have any questions for me? And she'll either state yes or no, or she'll ask her questions. And then we go on and we just say, Miss Beauty, is there anything that you would like to add? Or anything that you want Christine to know? And that's about it. So normally, like I said, I don't use this huge sheet of paper. I normally use a quarter size of it and I write very small. So you don't have to worry about taking this huge sheet of paper with you. All right, so that's basically how I give my report. If you have any questions, place your comments down below, your questions down below, and I'll definitely get back to you. See you in my next video. Hey, so that's a report in a nutshell. So I hope you were able to learn something. If you have any additional questions, just post them down below. You know, I'll get back to you as soon as I can. Go ahead and press that subscribe button if you haven't. Join me on this channel. We'll talk a lot about nursing, more mommy stuff, of course, and we'll throw in a little makeup here and there. So I'll see you next time, and I'll talk to you soon. Bye.